post-COVID breathing is stressed, high volume, rapid, erratic. People are anxious, right? They haven't felt well forever, seemingly. Some of them have been worried about whether they will, whether they're even going to survive it. Anxiety increases breath rate, and feelings of breathlessness also increase anxiety. So there's a little bit of a tail wag going on there. Lack of movement, just being sedentary for long periods of time, can increase and will increase breath rate. It lowers carbon dioxide levels, and as carbon dioxide levels go lower, it increases the impetus to breathe. The thermostat in the brain, the medulla, will trigger one to breathe more. It's like breathe, breathe, breathe. The only way to stop that is to actually increase CO2 levels. That's one of the primary ways to bring the breath rate back into function. When there's systemic inflammation in the body, that will also increase heart rate and breath rate as the body's fighting the infection, and even the residual inflammation that remains. It can kind of set the rate at high. Increased breath rate and volume also increases systemic inflammation. So it's like fanning the flames of the fire inside, all that big breathing. Mouth breathing accompanies stress, anxiety, and breathlessness, and is correlated with chest breathing and sympathetic nervous system activation. It's important to remember that all this big breathing is inefficient and exhausting. It decreases oxygenation. So the more people breathe, the worse they feel. So when we're looking at how do we organize a pranayama practice to support people post-COVID, we have to look at, do we go in the direction of Brahmana, tonifying and building, or do we go in the direction of Langana, calming, cooling, purifying, or both? My lean is a little bit of both. Post-COVID people are fragile. It's really, really critical to remember that. Their lungs are deconditioned, their muscles are deconditioned, their entire nervous system and respiratory system has been thrown off balance. They're chronically depleted and easily exhausted. And in addition, for any particular individual, they may be dealing with additional symptoms like pain or burning sensation, neurological symptoms, COVID toes, which I'm going to share a picture with one of my clients. You'll get to see what they look like. Brain fog and breathlessness, and some people, of course, have had also damage to their heart. So we need to build without exhausting and soothe and support while nourishing. It's important to keep in mind that just laying around isn't going to promote health. Like, they have to do something. And then the question is, how much? How do we titrate it so what they're doing isn't depleting them more, but is actually nourishing?